Hi, I'm Dr. Vinay, and I'm the chief at Northwestern Care Restoration. Today, today we're going to talk about one of my favorite procedures, ACS, or Autologous Cellular Serum. Remember, this is a more advanced form of PRP, or platelet-rich plasma. We have Jim here, who's volunteered to do an ACS treatment. We're going to walk him through what the process is. Now, I tell you this, a lot of people are used to hearing the words PRP. And again, this is a little bit more advanced form of PRP. So I always use the terminology PRP because, number one, it slips out of my mouth after so many years. But number two, because it's what Jim's used to hearing as well.
So what does it do? Does it make the density stronger?
Yep. Well, PRP has a lot of growth factors. But PRP, what it is like platelets are normal cells in your blood, and plasma is just a liquid part of the blood.
Right.
Platelets normally go to like cuts, and whenever you get an injury, and they release all their growth factors to start the healing process. So new blood vessels getting formed, new collagen being laid down, skin cells, hair cells replicate, closing up a wound. Mm-hmm. So we're going to take those platelets right now, isolate them, concentrate them, inject them right there, and then release these growth factors. We actually see them release while we're doing the procedure. And then hopefully we get more growth. So how does ACS work? Well, this is a natural treatment using your healing cells in your blood. These cells are called platelets. Platelets normally rush to injury sites. Like when you get a cut, platelets are the first cells to the site, and they're releasing all the growth factors involved with wound healing. That means a growth factor to bring in new blood vessels, new blood supply, a growth factor to lay down collagen, a growth factor to cause skin and hair cells to replicate and to close up the wound. So in the office, we're going to draw your blood. We're going to isolate these platelets very gently, and we're going to inject these platelets in your scalp. We're going to do this 4 times over 6 months to create a perfect healing environment for your hairs. Whatever it takes, man.
Cool.
So do like 3-4 sessions of this. And it's also all this area that we didn't address back here, right?
Yeah.
Is also what we're going to stimulate today. So we'll try to get this beefed up.
Have you ever done something like PRP before?
I haven't.
Like the procedure, what are your thoughts going into this?
I'm fine with it. I'm not. Needles don't really bug me. I'm all about whatever makes me feel and look good. Do it. So.
No pain, no gain, man.
I've gotten
It doesn't hurt. You have any questions?
No. How many? Oh yeah. How many injections is it?
That's a lot.
It is.
It's like probably 20 numbing, and then 300 to 400.
Oh really?
PRP.
Okay.
It's an intense PRP. Does ACS hurt? Well, I'm sure you guys heard that PRP hurts like crazy, and no one wants to go in for their second treatment. But I can tell you that ACS, even though it's way more extensive, does not hurt anywhere near as much as PRP. And that's because in a more extensive procedure, we actually have to deploy real anesthesia techniques, such as numbing up your scalp in order to perform the procedure. So as soon as you get numb, you don't feel anything, and that numbing process by itself is not too bad.
Vinay, have you heard any Fleetwood Mac since Jim's procedure?
Dude, I actually listened to like the entire Spotify channel, probably the next couple months after your procedure.
Did you?
Yeah. I think it's still on like my list. I actually got into it a little bit. It's just okay. So next part's the numbing. This is like that 10 minutes of discomfort. It tends to go pretty well. Once you're numb, then we have the ability to like just go to town with the PRP.
And should I expect any is there anything I have to do after the procedure?
I'm gonna show you one thing. You could get a little swelling in the front.
Okay.
I'm gonna show you how to massage that out, because the key thing about the swelling is it moves down with gravity.
Okay.
And you want to push it away from the eyes. So you're gonna push it up and out.
Okay.
Right? Don't get on a plane.
And that will be just for like a day or two?
Yeah, you'll see it on the second day, not the first day.
Got it.
All right, just some basic shots. Poke. Tolerable?
Yeah.
Oh, we should put on some music. Shit. In honor of this, Sleep with Mac, right? You feel pretty numb?
Yeah.
Can you feel this?
What's that?
Do you feel these pokes?
I felt that one.
Good.
Yeah. I feel like I have a bald cap on.
Have you straightened out your elbow? Do you have fun Halloween plans?
Not really. I'm not
Give me a chill.
super into Halloween.
Oh. But normally, yeah.
What are you guys into?
Halloween.
Dressing up.
Oh, yeah. I'm gonna take my daughter out. We're gonna be the Scooby-Doo crew.
Oh, so cute.
What are you?
I think I'm the truck.
The van?
Sure. Yeah. Is he, no, I think the dog or the truck. Beautiful.
What is she gonna be?
One of the characters. I don't know.
Yeah.
How are you gonna dress up as a whole truck?
Yeah, I'm curious.
I actually think I'm the dog, and my dog is the truck.
What?
Yeah, I think so. You okay, Jim?
What's that?
You okay?
Yeah.
It's a bloodletting process. All right.
Thank you.
No problem.
All right. So it goes inside this chamber. Put all the blood on the top. And then eventually the chamber is going to separate into liquid and the cells.
That's cool. So you don't have to put it in like any machine?
No, I'll put it in a machine. This actually goes in a machine and starts spinning, but this is like a special 2-chamber system that they use. We have a little extra in case we need it for later. But I'm just going to pop this in the centrifuge and I'll show you. Yeah, all the blood's on top right now.
Yeah.
This whole blood will separate out.
So crazy.
Let me go take care of this.
Can I see it?
Yeah, come on. You can check out our dirty laundry room.
I find this stuff interesting.
So we got regular PRP. There's the med spa stuff, and this is one specific for hair. So typically in a PRP treatment, you're drawing the blood, you're trying to isolate the platelets. But instead of isolating the platelets, those platelets often burst and release their growth factors. These growth factors are then injected in the scalp, and that's why we see some hair growth, but it's not as reliable as ACS, and this is why. In ACS, we're actually drawing the blood. We're being a lot more delicate with the cells. We don't want the platelets to burst. We actually want the platelets, because we want to inject the platelets directly into the scalp where they can release their growth factors more naturally, and they can also interact with other cells. We're seeing 10 times the concentration of growth factors, 10 times the amount of activation of these cells. And I can tell you, my results, maybe not 10x, but are significantly better. In fact, ACS is what changed my practice. On here, turn the cap. So tighten it. This is kind of a weird thing. They need to figure this out. It's a turn in 1/3. If you don't do that, it doesn't work.
Oh.
But it's a new system. They have that one little kink to figure out. Go. Some beautiful stuff. Let's take a look. All right, here we go, man. So top layer is a liquid, the plasma. This is essentially urine.
Urine?
Yeah.
Really?
Yeah, see, it's like literally what urine would look like. Your kidneys like filter out with this stuff. I mean, it's not pure urine,
Sweet.
but
Getting injected with pee.
and then there's the platelets. Are actually, these are the cells.
Okay.
This little chamber between like increases the pressure so much the cells to stay down here, and that goes up there. That's what we want. This is just the fluid to transfer stuff in. So a lot of times you go like a med spa, you'll just get this stuff. You want to actually get the cells.
So what's the bottom? Just super concentrated blood?
Yeah, it's just cellular parts. So we just twist this up, and you can start seeing it start going to that chamber. You'll see in the middle. You'll see like the cells move up in there.
That's crazy.
See it coming up
Oh yeah.
right there. Boom.
Weird.
and we just we don't want too much red. We just take that, swirl it in, and it becomes like murky.
That's so
orange.
crazy.
So real PRP is like, looks dirty. Music, back on.
So is this later Fleetwood Mac?
Huh?
Their club era.
Oh, is this not it?
This is decidedly not it.
No. Sounded right. All sounds the same. It's just a beat. You know what? Let's take a break and check out who this Fleetwood Mac person is. Let's go to Fleetwood Mac Wikipedia. Where are we at here? Fleetwood Mac are a British rock band formed in London. So it's not even American or Indian. 1967. Here we go. Here's their website, fleetwoodmac.com. Oh, website is broken. I'm gonna have to show these people are real. Let's go back. Oh, here's a song. Okay, so it's a girl. That's great. It's fine, whatever. Let's just play it and get on. Alright, see this little floaty thing in there?
Yeah.
Soon this is going to become a clot. And so we're going to form a heart attack inside this thing.
What do you mean?
I'll show you. But that's the beginning of the platelets releasing the growth factors. That's why this system's so much better than the other ones. It's like, actually, it's working. So
It's essentially a blood clot?
yeah, platelets are like they're injury cells. So you get a cut, the first thing you do is stop the bleeding.
So you're putting a blood clot in me?
Yeah. Okay. I feel like I need to correct myself here. We are not injecting Jim with a heart attack or a clot. So this is what's going on. In that syringe, we have collected the platelets. Now, platelets are wound healing cells. When they go to a cut, the first thing they do is stop the bleeding by forming a clot. So in the syringe, those platelets have formed a clot, releasing their growth factors that allow us to regrow the hair. But a corollary is a heart attack. In your body, when you have a heart attack, the same exact process is happening. The platelets are getting stuck on the blood vessels in your heart and forming a clot. If that clot blocks that artery, that's what causes a heart attack. So we're not injecting Jim with a heart attack. There's not really a heart attack in that syringe. So we're going to get back to the procedure. Jim's going to be safe. There's nothing to worry about.
Are you doing it?
Yeah.
Yeah, I don't feel it.
Oh, you're numb. We're going to do. The whole point is to be numb, but this is a pretty extensive part. I think that was probably 10 shots right there.
It's crazy because I don't even feel pressure.
Yeah, you're totally numb. Yes, hopefully all these hairs are going to thicken up, get a little darker. And it's like
Oh, it even darkens them a little?
Yeah.
Okay.
Anytime whenever your hair is thinning, it's also getting lighter.
Got it.
Not turning white, but like it's losing its color and density in general.
I did notice that. Like,
Okay, I'm gonna set you up. Do a little bit
okay.
towards the middle, then do the crown. Doing okay?
Yeah, I'm great.
All right, here we go. Here's a heart attack. Look at this. This little thing right here. It's a clot.
Oh, so really?
If that formed in your heart, that would kill you.
Why did that form in there?
It's the platelets. They're activated, so they form their clot, right?
That's crazy.
It's just like a wound. Now they've left all their growth factors in this leftover serum. This is why the system is so good. Is that you can't see that in any other PRP system.
So could you inject that in someone and they would die?
No, it's just not in a place where.
Okay, I'm like, is that gonna happen inside of me?
Your body forms clots probably multiple times a day, like for like little injuries you have.
Oh, really?
Yeah.
It's just only dangerous because like your heart or brain?
Yeah.
Wait, will you hold up the needle? I'm gonna take a pic. Oh yeah, perfect.
It's not a clot.
There's another one?
They're all gonna have it.
Wow.
There it goes. It's kind of cool. Just a little bit more. Sit you more forward.
It's okay. I always love coming over here because there's a Trader Joe's right here.
To try it that way. Yep, perfect. Nice, all done. Let me clean you up.
Oh, that's it?
Yeah. All right, so let me show you how to massage things out.
What'd you say?
Yeah, this is the part where, yeah, so get that in the mirror. So you see this white stuff here?
Yes.
That's gonna go away. That's just like the blood constrictor, so we can actually
Okay.
do this. But you see how there's a little bump, right?
Yeah.
This will move down with gravity, especially since there's more fluid in it.
Okay.
You want to clear it away from the eyes. So what you do is just go center outward. So you just push.
Like later today?
Yeah, later
Okay.
today. So you can see that I'll be able to flatten this out just by doing this.
Okay.
Because the lymphatics are right in front of your ear, so we're just trying to get them to come down this right channel. Otherwise, it gets into your eyes. This little thin skin here, it just pops up.
Okay.
So that's the only thing. If you do this, just essentially no problems with PRP.
Perfect. How long will this be numb?
2-3 hours.
All right.
You just can't do it right after we do PRP, because you don't want to move the PRP, so just wait like 3-4 hours.
Oh, got it.
I'm doing it now, and then you'll do it later. All right, the whole idea is to get away from the eyes.
Got
Make
it.
sense?
Yep.
How do you feel, Jim?
Great. That was a breeze. That honestly, that was like nothing.
It's not too bad, right?
No.
I think a lot of people think that PRP has to be bad. It doesn't really have to be.
It's so bizarre that like I can't like I hear you rubbing, but like I don't feel anything. It's so weird. That's so bizarre that I can't feel any of this. Is it naughty?
Yeah.
Pull away, I can't feel a thing.
Yeah, let me see if I got that.
Sorry, Tash, I gotta stop that. You're in town.
You go get a towel. You're back.
Did it come over? I can't even tell what he styled it like.
ACS is actually like a lunchtime procedure. You can walk into our office, get your treatment, and walk out looking absolutely normal. And over the next couple of days, if you massage your forehead and help the fluid kind of get out of your hairline, you're not going to see any side effects or any visibility to your treatments. It's actually a wonderful treatment because it fits your lifestyle so well. That's more like your style.
It's weird, I just feel hair, but no. Numbing's such a weird sensation. Thank you. That
Well done.
was nothing.
Yeah, it's not too bad.
No.
Remember to massage it out. That's all you gotta do.
Yeah.
Whenever.
You said wait like a few hours?
Yeah. So as soon as you see a bump, just do it. But wait, thanks, man.
Oh, thank you. Enjoy the champagne.